Hi everyone, welcome to Health Haven with Dr. Kels. Today, in honor of World Hypertension Day on May 17th, we're discussing a crucial health topic, hypertension, commonly known as high blood pressure. This year's theme is Measure Your Blood Pressure Accurately, Control It, Live Longer. Hypertension is often called the silent killer because it doesn't usually have noticeable symptoms while doing damage to the body. Let's dive into some frequently asked questions to help you understand and manage hypertension better. What is hypertension? So, what exactly is hypertension? Hypertension is a condition where the force of the blood against the artery walls is consistently too high. This, if untreated, can lead to health problems like heart disease, stroke, and kidney disease. Blood pressure is measured with two numbers, systolic, which is the top number, and diastolic, the bottom number. Normal blood pressure is typically around 120/80 millimeters of mercury. Why is it called the silent killer? Hypertension often has no symptoms until it has caused significant damage to the heart and arteries. Regular checks are essential because even without symptoms, high blood pressure can lead to serious health problems. What causes hypertension? Well, there are two types, primary and secondary. Primary or essential hypertension has no specific cause, but it is linked to several factors including genetics, unhealthy diet, particularly high in salt and low in fruits and vegetables, lack of physical activity, obesity, excessive alcohol consumption, and sometimes stress. On the other hand, secondary hypertension can result from underlying conditions like kidney disease, hormonal disorders, and medications. What are the symptoms of hypertension? Hypertension often has no identifiable symptoms, which is why it is referred to as a silent killer. If untreated, some people may experience headaches, shortness of breath, or nosebleeds. If blood pressure is dangerously high, it could cause damage to the vessels and lead to serious health issues such as heart attack, stroke, heart failure, kidney damage, vision loss, and cognitive decline. How is hypertension diagnosed? Blood pressure is measured using a cuff and gauge called a sphygmomanometer. Regular monitoring is important, especially if you have risk factors or a family history of hypertension. A consistent reading of 140/90 millimeters of mercury or higher typically indicates hypertension. How can you prevent or manage hypertension? Well, lifestyle changes are key. It's important to eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. You should limit salt, saturated fats, and sugar. Engaging in regular physical activity, such as 150 minutes of moderate exercise per week, is vital. Also, maintain a healthy weight, manage stress, limit alcohol, and avoid tobacco. What are the treatment options? Treatment often involves lifestyle changes such as diet modification, regular exercise, and weight loss. Medications can also be prescribed for the treatment of hypertension. Treatment plans are personalized based on individual health needs. Can hypertension be cured? Hypertension often requires lifelong management. While it can't usually be cured, it can be controlled with lifestyle changes and medication. How often should you check your blood pressure? Well, regular monitoring is essential. Home blood pressure monitors are widely available and quite easy to use. Monitoring your blood pressure at home can really help track your condition and ensure your treatment is working effectively. For those at higher risk or with elevated blood pressure, it's important to check it more frequently, as advised by the healthcare provider. Are there any natural remedies for lowering blood pressure? Indeed, there are some natural approaches that can help lower blood pressure. These include eating a diet rich in fruits, vegetables, and whole grains, reducing sodium intake, increasing potassium intake, engaging in regular physical activity, and managing stress through techniques like yoga or meditation. Does hypertension run in families? Yes, genetics can indeed play a role in hypertension. If you have a family history of high blood pressure, you may be at a higher risk and should take preventive measures and have regular checkups. Can children have hypertension? Yes, children can indeed develop hypertension, although it's less common compared to adults. Risk factors for hypertension in children include obesity, a family history of the condition, and underlying medical conditions. Pediatric hypertension is diagnosed and treated similarly to adult hypertension, with a primary focus on lifestyle changes and, if necessary, medication. What role does diet play in managing hypertension? The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is a dietary plan specifically designed to help lower blood pressure and improve overall heart health. It emphasizes the consumption of fruits, vegetables, whole grains, and low-fat dairy, while reducing intake of salt, sugar, and saturated fats. How does stress affect blood pressure? Well, stress does not directly cause hypertension, but it can certainly worsen it. Managing stress through relaxation techniques, exercise, and engaging in hobbies can help maintain normal blood pressure levels. However, do not assume that stress is the sole cause of your high blood pressure. If in doubt, it's crucial to see your doctor for a proper evaluation. How does physical activity influence blood pressure? Regular exercise strengthens the heart, enabling it to pump blood with less effort. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity each week. What should you do if you have a high blood pressure reading? If your reading is high, relax for a few minutes and measure again. If it's still high, consult your doctor for proper evaluation. In conclusion, understanding hypertension is vital for its prevention and management. By making healthy lifestyle choices, regularly monitoring your blood pressure, and following your doctor's advice, you can control hypertension and reduce your risk of serious health complications. Don't let the silent killer take you by surprise. Remember, measure your blood pressure accurately, control it, live longer. If you have any questions or topics you want us to cover, simply drop a comment. Thank you for watching. Don't forget to like, share, and subscribe for more health tips. Also, ring the notification bell to be updated on new content. Let's spread awareness about hypertension together. Stay healthy and see you in the next video.